The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of cosmetic dentistry. My first guest is Dr. Ken Krauss. Dr. Krauss, welcome to the program.
Thank you very much.
Now, before we get into today's topic, your practice, Bakersfield Smile Design. How long have you been there?
We've been there 5 years, Randy.
Okay.
And I don't know, where should I begin? It's a wonderful practice. I love what I do. I have a great staff.
You call it a boutique practice. What do you mean by that? You told me that.
A boutique practice would be considered to be one where you there's more of an emphasis on the individual needs of the patient.
Okay.
Okay. So in other words, one of the things that we want patients to feel like when they come in there is that they are an individual and that we care about them, each and every one of them.
So what type of procedures do you do? I mean, do you do everything there or just cosmetic?
Not solely cosmetic. We do have a focus on cosmetic dentistry. I feel like that's one of our areas where we really excel. But it is a family-oriented practice. We do a broad base of general dentistry.
Fillings and everything.
First of all, connected to the set of teeth, there's a person there.
All right.
Okay? And that everything that we do has to do with not only functionality, making things work good and making people feel comfortable, but also making things look good. So whether we're doing a simple filling, we're concerned, how is that going to look when the person is smiling?
You told me that on the telephone. You said everything I do is cosmetic dentistry.
What I meant by that is that every procedure that we do is we're considering how is this going to look. Okay. So in other words, when you smile, not only just when you smile, but when you laugh, are you concerned about that big silver filling that you have in the back of your mouth? Okay. So everything that we do, whether it's in the back of your mouth or the front of your mouth, we want to make sure that it looks as natural and as functional and as durable as it can be.
So you're training, Loma Linda University.
Absolutely. Absolutely loved it there.
I mean, that's a well-known place for dentistry.
Yes, it is. And one of the things I loved about Loma Linda and the reason why I chose to go there is because of the emphasis on not just the knowledge that you learn in the classroom, but putting that knowledge to practical use. In other words, taking the skills that you have innately and using it on the patients for their good and their betterment.
Now you don't look like a typical dentist, by the way, to me.
Okay.
What is a typical dentist? I don't know, but you don't look like a dentist.
All right.
I mean, when did you know you wanted to be a dentist?
Okay, this is the honest truth. When I was a young boy, I broke out a tooth in the front of my mouth. Okay. And I had it fixed up with the best they could, and actually had to go through a couple of fixes. And I found that through my life I was hiding my own smile. And also the dentists that I went to were good. They were good people, and so I always felt like, hey, I liked the way they lived, I liked the way they were, and so that's something I thought about wanting to do ever since I was young because of that.
You knew right away, 10 years old, 12 years old?
Yeah, I knew when I was young that would be something that I would love to do, to be able to do that for somebody, to help them so they're not conscious about how they look and how they feel. Because believe me, I know what it's like to have a problem with your smile and to not be able to smile.
All right.
Okay?
Now, I know you have 6 kids.
That's right.
You say. Any of them want to be a dentist?
Well, of course, all of your kids are going to say they want to do what their dad does when they grow older. So,
okay.
But, I have a son that he has expressed some interest. We'll see.
Okay, now cosmetic dentistry, which is today's topic, that's why we invited you on the show. One of the things you told me, which I liked on the telephone, we had Debbie on the show, you said, Randy, you could stack my work against anyone's. And you'll be impressed. I mean, do you believe that?
Yes, I do, because I will make sure that it's right.
Okay.
And another important component to that is using a lab, an excellent lab
that makes
works
the
with
veneers.
you. That's right. You ask anybody you know, and I'm the one that chooses the lab, and I'm the one that makes those decisions. And if you're not using a good lab, if you don't have that picky eye,
the teeth can look fake.
Oh, absolutely.
So there's cheap labs, I guess?
Oh, absolutely. Yeah. Who hasn't seen somebody who has a smile that, you don't want to embarrass that person by saying, gosh, your smile looks fake.
Yeah, I shouldn't say this on air, but I told you, I could spot, I feel like veneers 20 yards away.
And you can, if they're not done correctly. You're going to be able to tell when somebody's had some work done where they look fake. They don't. And I'll tell you, that's one of the first things that patients say, Dr. Krauss, I'm not going to look like I have veneers. They aren't going to look fake. Yes, I want my smile to look better, and people are going to go, wow, your smile looks great, but it looks good because it looks good, and it looks like it belongs to them. It fits their face. It fits the way they look. But it doesn't stand out as being too white, too big.
So it's art and science?
Yeah,
I mean,
absolutely.
How much art, how much science, in your opinion?
There is definitely a science involved of being able to define, the parameters of how a tooth is supposed to look. Criteria that we don't normally think about. And you can break it down into its elements. So there is a scientific aspect to it. But the artwork comes in of being able to take all those elements and put them together so they flow. And what I mean by that is there's a lot of determinations that decide how a person's teeth should look. The size and shape of their face,
Okay.
Their smile line, the thickness.
What does that mean,
of
smile line?
Smile line is when you smile, there's actually a line that you can follow, with your upper lip. And there is a relationship between that upper lip and the length of those teeth. And if that's not right, then it's going to look funny.
Look a little off. Interesting.
It is going to be off. Also, teeth, believe it or not, are not just one color. They actually have multicolors in them. The lab working with you has to know how to manipulate the porcelain to give it that look that it needs to have, so it doesn't look like that horse chiclet look that we're all trying to avoid.
Now, before we get into veneers, because I have a lot of questions about the veneering process.
Right.
How do you get started? How do you design it? How do they pick their smile?
Okay.
But as, from a dentist standpoint, how important do you think the smile is?
From my point of view, the smile is everything. Okay, now.
Well, you're biased because you're a dentist.
Right. Bear in mind, I said earlier in our interview that I had a problem myself where, with a tooth where I was self-conscious about it. And every single patient, looking at my own, history of that, having that problem, and every patient, that's the first thing they say, I'm tired of not being able to, be me. Okay, and what I mean by
Do they
that.
actually say that? I mean,
Absolutely. They're not able to be who they really are. If you're self-conscious and you're having to, focus on hiding your smile.
People do that.
Oh yeah, absolutely. We all know that they do, and everybody
Well,
out
I don't
there.
notice it, obviously.
Well, that's because you have nice teeth. Anybody out there that's listening to this right now is going to completely relate to this, and they're going to know he is absolutely right, and it's the truth. And if you're able to smile, if you're able to be who you are, laugh, smile, you're going to fully express yourself. And when you're trying to hold back all the time because of that, it doesn't feel good. It has a huge impact.
Do they say, you fix somebody's smile, do they feel like their life's changed sometimes?
Absolutely.
Do they act differently? Their self-esteem is
Absolutely, without a doubt.
What do they tell you?
Well, first of all, a lot of times it's not just what they say, but it's the look, in their eyes and the tears. People get really emotional. Somebody had to intervene to help them. And so they come back universally and say, this has been a life-changing thing for me.
So it's rewarding? Do you like, you must like that, I guess.
Oh, absolutely. That, to tell you the truth, as far as dentistry goes, that to me is the pinnacle. Yes, it's great to help somebody get out of pain and help them fix any problem they have. But when you can do something for somebody on that scale that they would consider to be life-changing, that is life-changing.
You think people are judged based on their smiles?
Every day. Because it all comes back to this. If you can't smile, if you can't express yourself, you're holding yourself back.
You say that teeth can be a dead giveaway of age.
Without a doubt. As we get older, naturally, our teeth are going to show the signs of wear. The things that we eat, the things that we drink are naturally going to stain our teeth. Okay, we're naturally going to wear our teeth.
Get a little shorter?
Absolutely. What happens with a lot of people is, depending on how their bite is, they're going to start wearing the ends of their teeth off. Okay? And that needs to be restored. And it makes a big difference. If you have yellow, dingy, short teeth because of wear and because of staining that happens over the course of time, it definitely ages you.
So what do you say to the person that just can't get themselves to, do something nice for themselves? They don't like their teeth.
Well, here's the thing. If you do nothing, nothing is going to change. Okay? And it's not going to hurt you to at least talk to someone about it. So my suggestion is...
So consultation.
It's never going to hurt for you to have a consultation.
Do they meet with you, by the way? Every consultation is done by
every single one, they're going to be meeting with me. Okay? If you let me, I can tell you all day long what I think that you need.
Okay.
But what I do, like I said, having been there myself, I want to sit down and hear what you think. I want to know where you're coming from, okay? Because each and every person is unique. Everyone's an individual, and every situation is unique.
Okay.
And if I don't know what you want, if I don't know where you're coming from, okay, then I can't truly help you. Because when, let's say if you decide to do the treatment, in the final analysis, if you're not absolutely happy because I didn't listen to you, then I'm not happy.
Are there a lot of people, do you, people that get veneers that they don't like the outcome? Do they end up in your lap sometimes?
Oh yeah, absolutely. I had a case here just a few months ago, a gal And she went out and had some work done by someone, and you know, it was a disaster. I have to tell you, they didn't look natural. She couldn't take care of them properly the way it was done. She was having problems with them, and it was very apparent to me, you know, that they need to be redone. But how should I say it? I didn't want to break her heart.
So did you fix it? I mean, are you going to?
I did. So eventually, what happened is it just became a problem she couldn't bear anymore. Because so we actually did last fall. We, you know, redid her smile for her.
Now she's happy.
She's excited. She says, Dr. Krauss, I don't worry that if I go out to eat somewhere that, you know, something is going to come off, and you know, and they look natural. I feel good about it. I don't have pain anymore.
Okay.
Unfortunately, the person who did it would be considered to be, by many people, to be reputable. Okay. But what I think they don't really care about the person.
Or maybe they don't have an eye, you think?
I think it's probably a combination. But if you are not a person who really, you know, wants to do it right, okay, you've got to want to do it right. So look for
well, how do you find a dentist? I mean, how do you know if a dentist wants to do it right?
You want to find someone who really has a passion for it, who says, you know, I can do it.
You love it. I mean, so
and I love it. And the thing is that, you know, I have the results also to back it up.
Now we're going to take a quick break. We come back. I want you to take me through the process of the veneering process. You know, what goes into the design of the teeth, etc. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, what you need to know about the veneer process. We'll be right back.